Let's talk about the benefits and limitations of massage as a treatment for scoliosis. One treatment that comes into question regarding scoliosis is how beneficial is massage for the treatment of scoliosis. Now, in order to understand that question, to explore the benefits of massage and scoliosis treatment, is that first we have to understand the difference. Is number one, are we using the treatment to actually reduce a scoliosis? That is treating somebody's scoliosis. Or number two, are you treating the symptoms of scoliosis, which could possibly be pain, muscle spasm, tightness, lack of range of motion, or those things, because they're very different. Because what we find is some of these treatments to help reduce or improve the symptoms that are associated with scoliosis are very different than actually treating somebody's scoliosis, if that makes sense. So massage, number one, definitely can help relieve pain. So what I find with adult patients, they can have pain associated with scoliosis or some stiffness or some tightness. So a lot of times they would seek massage as a treatment to help reduce or improve the pain or tightness they're feeling. However, what ends up happening is they don't get any real long-term benefits because the tightness or the muscle spasm or the incongruency of the balance of the muscles and tissues are a result of the curvature in the spine, which is the scoliosis itself. So that's where massage isn't not effective. It won't reduce the curve itself because scoliosis is much more than just tight muscles. But there are some benefits when it comes to using this. Number one is that it does increase a little bit of mobility in the area, which could improve some flexibility. There is a relaxation component when it comes to massage, which has its own benefit because a lot of people with scoliosis, especially adult patients, can have periods of stress because of their spine itself, but of lifetime stress. And the lifetime stress could also cause more tightness of muscles. This relaxation response can also have this relaxation in muscle tissues, but most importantly is it can help with pain. And I think that's the number one reason why people will go seek massage as a treatment option, because it helps them with the pain that they could be feeling. Normally muscular type of pain. Not so effective with nerve type of pain or bone or joint type of pain, but more like muscular pain. So why doesn't massage in itself actually treat or reduce somebody's scoliosis? And the big thing here is that scoliosis is a structural problem. And what I mean by that is when we do bending x-rays or flexibility studies regarding scoliosis patients, is that you find when patients bend, the curve doesn't go away. Meaning, if somebody just had a muscular problem, if they were to bend left or right, the spine will still move pretty normally. However, in a scoliosis patients, when they bend left or right, whatever trying to bend out of the curve kind of stays to a certain degree. And the stronger it stays under these bending films, the more structural it is, meaning just moving muscles isn't reducing the curve, meaning that there's no way that just massaging the spine is going to actually change the structure. But it definitely can help with pain because it's helped mobilizing some muscles that haven't moved so well because of the lack of motion. So that's how it helps with the pain, but it doesn't reduce the curve itself. One question I get asked is, can massage ever be harmful for scoliosis as a treatment option? And I'll say in most cases, no, because since the forces are not great enough to move a spine in one direction or the other, it can't really provide any harm. So therefore, it's not going to make your scoliosis worse. That's for sure. I don't think that's even possible. So what we do recommend, though, is because of the asymmetry associated with scoliosis, meaning how the spine isn't balanced, I definitely recommend that you find somebody who knows how to take care of a scoliosis patient, because the goal of a scoliosis patient is not always to get the muscles to be symmetrical, because that's not possible, because we're not going to get their spine completely straight. The goal is to decrease what you find in that particular curve type, not necessarily making perfectly symmetrical. And that's where sometimes massage therapists become frustrated, because they don't understand that the tightening of the muscles is the body reacting to help support the body or the spine in that asymmetrical or curved position. So when it comes to scoliosis and massage, there's a couple things that you have to understand. Is yes, massage can definitely help treat pain, mostly muscular type of pain, tightness, soreness, those types of things. Number two is that it does not address the structural problem associated with scoliosis. So if you're trying to reduce your curve with massage alone, that's not going to be the outcome, more than likely. And if you're getting massage, try to find somebody who specializes or understands scoliosis, not just sports massages or those kinds of things. You want to deal with somebody who understands the nature of scoliosis and trying to optimize that muscle balance where we know we can't achieve perfect balance. However, you should always be working to reduce your scoliosis, and the way to reduce it is to find somebody or a doctor who can actually treat the structure associated that's causing all the things that you're dealing with when it comes to scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.